And good afternoon, everybody. It is September 16th, and we have our bi-weekly COVID update for Nevada County. And as usual, we will start up with the guy who has all the numbers, all the data, and maybe even some good news. Ryan, you're up.
All right, thank you for having me. I'm Ryan Gruver, the county's Health and Human Services Director, and I think with your permission, Pascal, I'd like to show a brief presentation today with some charts, which are my love language, and so I want to share that with everyone else. And this is a chart that I've shared previously in terms of our cases per week, which goes back to, I believe, mid-August last year, and really shows the roller coaster that we've been on in terms of COVID cases over the last year and a half. So what we thought was significant cases around the 34th, 33 per week last summer skyrocketed over the winter and the holiday months to where we got up to almost 400 cases over a weekly period. Then with the rollout of the vaccines in the world of our previous strains of COVID-19, we saw a significant decline along with much of the state to where we got down to 26 cases towards the middle of June before the state lifted the blueprint for a safer economy at the same time as the Delta variant started becoming pervasive. And I have a slide on the variants in a moment, but you can see what happened after that. We saw a dramatic spike in cases to the point where over the last 6 weeks, 4 of those weeks eclipsed the peak that we experienced over last winter, resulting in an influx of patients in the hospital and tragically trailing hospitalization and increase in deaths getting added to our dashboard as well. I think the glimmer of positive to report is that our cases were down somewhat last week. We want to keep our eye on that and make sure that that's something that's a trend as opposed to something that's just a temporary blip on the radar. And so definitely continuing to monitor that closely, but hopeful that we are on a downslope. So the next thing I'll show, and this comes from data that's on the state's website in terms of the variants over time. We get a lot of questions around the cases that are being recorded and whether they're Delta variant or something else. Want to make clear that not every test that's taken is sequenced for its variant. That is done at certain labs, and it's asymmetrical throughout the state and takes time to compute. But the state has been reporting out percentages of the different variants over time, and this chart really shows what's happened. You have variants become prevalent and then are replaced by a new variant, and you can see that Delta has taken off to the point where it's pretty much crowded everything else out. It's 99% of the samples that are sequenced across the state as of August. Something that the state just began reporting, another frequent question that we get is how many of the cases are vaccinated versus not vaccinated. And you can see, we can certainly share out links to where the state is reporting this data on their dashboard, but the vast majority of the cases that are being seen across the state are in unvaccinated individuals. You're, based on their data, about 8 times more likely to get COVID if you're unvaccinated compared to if you're vaccinated. We have also begun reporting out that data in the county. And so this chart represents what we're seeing in Nevada County related to vaccinated and unvaccinated cases. And you can see similar that the vast majority of the cases are in unvaccinated individuals. We're seeing in the neighborhood of 20% of our cases in vaccinated individuals, which is about what you'd expect when you consider the known effectiveness of the vaccine. And then the last thing I just want to point out and make clear that this is very hypothetical, but if you were to assume that people get sick or that we did not have the vaccines, that the entire population was getting COVID at the same rate that the unvaccinated currently are, you could see we would be in a much worse place. The blue represents what's actually happened. The orange represents what would happen if none of the population was vaccinated, assuming it's consistent. And then the gray represents if 100% of the population was vaccinated, which we're certainly never going to get there. Of course, I'd rather be in the gray, but I'm grateful that we're not in the orange. And so I just want to continue to express gratitude for having safe and effective vaccines, because if we were seeing 800 cases in a week, it would be certainly a situation where our hospitals would be overwhelmed and people would not be able to get the care that they need. And so it's imperative to get as many people vaccinated as possible. But we're very lucky that we have the vaccines to help us through the Delta variant. And I will stop screen sharing and turn it over to others now.
Thank you, Ryan. But hey, it's good news, and it's also great to see that there's a little more detailed information available, especially with vaccinated, unvaccinated, because that is, of course, one of the questions that comes up every single time. And we have a couple others that one of them, and I believe this one would be for Jill. It sounds like County Public Health Department lacks the resources to conduct contact tracing in general, as well as assisting the schools with the new order. And additionally, the person says, I hear schools are struggling to get COVID test kits and many don't have plans to conduct the CDPH recommended screening. So what do we need to do to address these limitations? More money, budget, more staff? And is there anything that the community can do to help?
Okay, lots of parts to that question. So let me start at the beginning. So our public health department definitely has resources for contact tracing, but when we have 600, 800 active cases, I mean, that's really beyond anything that we could remain staffed up for. I think the challenges that we are experiencing are being experienced across local health jurisdictions, across the state, across the country, trying to keep up with this surge that is created by the Delta variant. So we definitely have resources, but we cannot address every single case. That is true, which is why both at a local level, at the state level, and the CDC make recommendations about how to prioritize your case investigation and contact tracing efforts when you do get to a point where you have more cases than you can handle. As Ryan was stating earlier, if you have 448 in a week, followed by 400 more another week or previous week, it's a bit much for a jurisdiction our size. But we do prioritize and we make sure that we're getting to the most at-risk populations in our efforts. The schools, yes, also struggling. So I'll start with test kits. So schools, the state has made available to schools free testing supplies, and they can enroll in a testing program where they can also get their samples processed for free. If they're involved in the state program, they can either go about testing in that way, or they can contract out with a private provider to do COVID testing at their school. For the schools that are involved in the state's testing program, I think that what happened was a number of schools didn't register for testing programs until after the school year started or very close to the beginning of the school year. So I think there was a large demand for testing supplies at the same time that there was a national shortage on the Buy Next Now test kits, which are the rapid test kits that the state was supplying schools with. I can say that the state feels confident now. There was I think probably a 2-week lull where they were having difficulty meeting the need of schools. But we know, I talked to one school district this week and they were told they were going to have to wait 2 weeks for their test kits, and they got over 5,000 test kits this week. So it seems like that break in delivery has been resolved at the state level, and the state communicated with us just last night that they feel confident that they can meet the needs of schools that are involved in the state's testing program. In terms of contact tracing, I'll say that the schools have also gotten resources to bring on contact tracers. Schools always participate in contact tracing when there's a communicable disease outbreak in their school. They're the only ones on site who have the knowledge about exposures. So they've always been involved in those investigations and in contact tracing anytime there's been a school-based outbreak. They are able to bring on additional contact tracers, but I think they are experiencing what every other entity is experiencing, which is it's difficult to make those hires right now. It's difficult to find those bodies because everybody is looking for contact tracers. So when we know of resources of places where schools can contract or people they can reach out to identify those services and contract for those services, we make sure that we provide that information to them, and some of that has resulted in schools bringing on those contracted services. In terms of what else can be done, we were talking about this a little bit earlier about what can be done to help the contact tracers. And one thing that people can do in the community to help contact tracers is actually take the call from a contact tracer if they reach out to you. We've heard from our nurse that when we have school-age children that we're looking at through case investigation and contact tracing, sometimes the parents won't take the call. Sometimes the parents won't divulge which school their child goes to. It just creates a lot of additional work for the team to try to get to the bottom of these cases. So that is at least one thing the community can do in terms of supporting both the health department and schools in their contact tracing efforts. I feel like I probably left something out, Pascal. I'm not sure if I got the whole points on your question.
I think you get most of it, and I believe the question about what can the community do was also, is there a way to people who want to volunteer, can they take a course? Can they become contact tracers? Is there a process for that?
There are processes, there are trainings available, and when we bring on contact tracers, we take them through the state program. The state has made that program available, pretty widely available, and we've gotten really good feedback about that contact tracing training. I don't know what limitations schools have in terms of bringing on volunteers who are trained, or whether or not they need to bring on hired staff. That would be a better question for schools. But if somebody is interested in contact tracing at a particular school location, they could certainly reach out to that school and offer up their time and services.
I think it was also for public health. I mean, if you are, since you mentioned that you have, I mean, it's basically impossible to follow all these active cases because you just don't have enough people. Can people reach out to you and become contact tracers?
We have vacancies listed on the county's NeoGov site for health technicians, and those are the positions, and some nursing positions as well. Those are some part-time temporary positions that we use for contact tracers. So if people meet those qualifications, please do apply.
Anything additional from our health experts?
Yeah, I would like to say that to support public health in general, what public health does is help the health of the public, and sometimes these mandates, I know they compromise some of your perhaps personal freedoms, but it's for the public good. We'd like to get a cap on this pandemic, particularly the Delta variant. As Ryan showed you the graphs, hopefully we're seeing a little downturn, but there's a lot of work to be done, and it has to be done collaboratively. That includes, as Joe mentioned, we're working very closely with the schools, but also we need to work with the community closely. So support public health. That's one thing the community can do. Thanks.
And then Ryan, you mentioned fatalities, and one of the questions we got was, do we know of the approximately 14 fatalities that were added over the past months? How many of those were unvaccinated people, or is that data available?
I can speak to that if you want, Ryan.
Sure.
So we haven't done that calculation. We know of at least one death in a vaccinated person. Of the, I think, 16 recently reported deaths. One was in a fully vaccinated person. And Dr. Trochet, do you want to say something about underlying conditions or about just the likelihood of somebody who's fully vaccinated being hospitalized or succumbing to the disease?
So overall, we know, and I'm not speaking specifically about Nevada County, that being vaccinated decreases your risk of hospitalization and of death. So I also only know of one vaccinated person who has died of COVID in the last month. And my understanding was that this was someone who was elderly with underlying conditions, which is what tends to be the case when vaccinated people end up in the hospital. They tend to be folks that did not mount as good a immune response to the vaccine as younger, healthier people might have. So my understanding is, I think the state has said that being vaccinated decreases your risk of being hospitalized if you should get COVID-19. People who are unvaccinated are 10 times more likely to end up in the hospital as people who are vaccinated. And the proportion is even higher of people who are likely to die if they're unvaccinated versus people who are vaccinated. So I think Nevada County mirrors that.
And then Dr. Stevens, I have a question for you that one of our readers sent in, talking about, so flu season is coming, and we're told that get the flu shot early, should get the flu shot before October. And are there any, is it okay to get say the COVID vaccine and the flu shot, or is there, is there a time in between the shots? So how is that going to work? And otherwise, and maybe also address if there's a risk of what is now the hashtag, I believe, is twindemic, so which would be flu plus COVID.
Yeah, thanks for asking that question, Pascal. So yeah, we are all concerned that we're moving into the fall and we're going to see more flu. I think we've already seen a couple cases in our clinics of people who tested positive for the flu. So yes, please get your flu vaccine, because that is another way to prevent hospitalization and deaths from the flu. However, you can get both of your COVID-19 vaccines and your COVID vaccine, your flu vaccine and your COVID vaccine together. They can be given on the same day. So that is something that may be more convenient to folks. Typically California sees like a peak of a flu season more into December, January, February. But this year, as we've all been kind of indoors for a while, we may see that sooner. So it is important to get that as soon as that's offered to you. And yes, you can get it together.
Anyone wanting to add something to the flu? And by the way, will there be a drive-through clinic from public health? And will you have more doses available this year?
Yes, I think we're going to put out some information as early as Friday. So our drive-through flu clinic is scheduled for October 5th. And the number of doses, it looks like we'll have a few more than last year, but I don't want to confirm the number until it's confirmed for us. But yeah, we're hoping that people will show up and hopefully pace themselves as they show up as well. I know last year there was such a, people were so excited to get their flu shots, which we really appreciate. But we did have a few traffic issues. So the clinic is planned for Tuesday, October 5th from noon to 4.
So in other words, you're going to get more doses so that at least there will be doses available, say, for the first 25 minutes this time around.
Well, we get our doses from the state, so we don't have total control. We make requests and then we use what we are given by the date that we hold the event. But yeah, I have no doubt we'll have hundreds of doses. I just don't know how many hundreds of doses. Yeah.
And again, if like me, you were in the, I believe we got to the line 15 minutes after it started and tried then to turn around, being part of the traffic issues. There's always your pharmacies, there is your physicians. So if you want the flu shot, there are lots of options for getting it. And a couple of questions here from our Q&A. There's been news of possible vaccinations for younger kids on the horizon. Do we know how quickly there could be an approval for those, at least emergency use approval? And if there is a vaccine available for children under 12, how soon would they be available in Nevada County? Are there any supply issues?
The vaccine that is most likely to be approved for children first is the Pfizer vaccine, because they put in their data for ahead of other manufacturers. It will probably be the same vaccine as is given to adults, although the dose may be different for children. We've been told that emergency authorization is imminent now for a couple months. So we really can't say. It's hard to predict when it's going to be authorized. But once it's authorized, it should be very shortly after that it will be available for children between the ages of 5 and 11. And the other 2 vaccines will eventually also be authorized for people under the age of 18. So stay tuned. Unfortunately, our crystal ball is a little cloudy right now. We can't tell you exactly, but yes, it is likely that very soon it will be authorized for the younger age group.
And one question is, if you get the Moderna shot, can you get a different shot for a booster? And let's talk about boosters. Last I heard, there's still no decision of if boosters are recommended or not for general population, etc. So can we address the question of, can you mix and match with boosters, and then booster shots, if they are recommended, what would be the process?
So,
Dr. Stevens, go ahead.
Sure. So as you alluded to, yesterday the FDA did meet and did not comment on whether we should be proceeding with booster shots. So booster shots are not recommended at this time, unless, and this is more for a 3rd dose, unless you are severely or moderately immunocompromised. Then it shows that the vaccine, just 2 doses, is not enough to really mount that strong immune response. So you do need that 3rd dose. But when we talk about boosters, we're basically saying that maybe immunity is waning throughout time, and you need another exposure to that antigen to mount that response. And the science is kind of mixed on that, and so that's why there's a lot of debate going on. Part of this committee with the CDC called the ACIP is going to be meeting next week to for 2 days to discuss that a little bit more. And then I think the question about getting another type of vaccine for your 2nd dose, currently is not recommended. I know that question may have come out of some of the studies coming out of the UK looking at better immune response with doing that, but I think that still the jury is not out on that yet. So it's not something that's recommended by the CDC at this time.
Sadly, it's become a bit politicized about boosters, and I think the current administration got a little ahead of itself and didn't wait for the science. And the science has been, it's been a little difficult to elucidate, but it seems like probably boosters will be approved. We're not sure when, but probably. And they're mainly talking about boosters for messenger RNA, not for Johnson & Johnson. Parenthetically, we're finding that the breakthroughs are distributed equally with respect to the number of immunizations given with respect to the type of immunization. So we're not seeing any more breakthroughs in Johnson & Johnson than we're seeing in the messenger RNA. So they seem to be effective keeping people out of the hospital and keeping them out of the ICU, even now. So stay tuned.
And this is an interesting one. Can you speak to why the vaccination rate and the test positivity rates are important metrics for understanding transmission rates in our community, and why are those stats not on the county dashboard? And Ryan, your graph, the cases by week, can that go on the dashboard too? That would help the person make decisions about risk for the family. I think that something similar might already be on the dashboard. There are various tabs and stuff, but the test positivity and vaccination rates, why are those important metrics?
So I'll just speak briefly to why the test positivity isn't on the dashboard. That number is actually out on the state's dashboard, and we can post the link to that. And when for a time we were posting out a positivity rate, and in instances where that was out of sync, it just created a lot of confusion. And so given that the state is computing that already, it's more helpful to refer people to one source of information. In terms of the chart that I presented, I take that from the county's dashboard. I just add up the cases each week. So the dashboard is fairly manual to produce. And so we sort of pick and choose what we can invest important staff time in getting out there. I think there would probably be a way for us to post out what I put together each week somewhere else, but not integrate into the actual dashboard, just because it is, as I said, complicated to put together. But I don't know if Jill, you have anything to add to that, or others, if you have anything to express in terms of why those things are important to keep track of.
I'll just set the dashboard and let the docs chime in on why they're important to keep track of. Vaccination rates, clearly, I think everybody understands why they're important to keep track of, because we want to understand just how protected our community is. And actually, vaccination rate, that might be something we can include on our dashboard. We have a more in-depth view than I think is available to the public. So we can talk to our IS department about incorporating that into the dashboard. As Ryan indicated, his graph is something that he creates from pulling that dashboard, and as Pascal mentioned, which I think a lot of people don't necessarily see, you can click on the link on the bottom of the dashboard and it expands, and there are multiple tabs. And so you can look at the data through multiple lenses. So vaccination rate, great idea. I'll see if I can get that incorporated into our dashboard. Ryan's graph, not so easy.
So the case rate and the test positivity percentage are the way that we keep track of how much virus is circulating in our community. So the higher the case rate, the higher the test positivity rate, the more concerned we become, because we know that the likelihood that just walking around in our community, you might come across the virus. As those go down, the likelihood that you will be infected when you're out and about goes down too. So that's why we keep track of those two measures.
And then the other part is it helps us kind of see a little glimpse into the future as well. So like the R value goes up first, then the test positivity, then the case rates, then the hospitalizations, and then the deaths. So it kind of gives us a good glimpse when we kind of look at the trends there.
And there were quite a few questions about masks and masks in businesses, and how to enforce that, and what's the approach to have people actually respect the wearing the masks. And so, and I think that's something we yesterday on the media call, we discussed it a little bit, and it's mostly that, you know, if you wear a mask and somebody else is not wearing a mask, and you don't really think that you don't feel safe, then, well, pick another store. That's one of the things. And the other one is, of course, that in some very rare cases, people cannot wear a mask. Apparently, those cases are out there. But it's up to everybody to make the decision if you actually want to protect your fellow residents and see what's going on there. But can we briefly talk about what else? So the mask and the social distancing, there's been a couple preprint studies now that say that maybe the social distancing, that the 6 feet are not enough, and others that say 3 feet, 3 feet's fine. So who wants to tackle that one?
Just a quick comment is, although the rates are improving in this community, I think we have 33 per 100,000. I think that's the current rate, but it's 3 times what it would be the number to keep us in the purple tier if we were still in the blueprint, which would mean everything would be closed. Not everything, but restaurants would be outdoor dining, and churches 25%, and place of worship 25% capacity, and schools not open. And And so the reason for these actually mandates are that it's going to keep us safe in the midst of this pandemic, because we still have a high level of virus circulating. Our rates are still twice, 50% higher than the average state. And so we're just trying to protect the average citizen. And that's what it's all about. A mask, yeah, it can help you personally, but it's mainly protects the person you come in contact with. It stops the droplets, not the aerosolized version. It doesn't stop a virus, it stops the droplets, and that's the reason it's so effective. So your primary protection is vaccination, and secondary protection is masking. And if you do that, you can feel comfortable of going into a store. I would say it's going to an establishment where they're not masking, or if they have a sign out for us just suggesting that you mask rather than saying it's a mandate. I don't think I'd frequent it, and I would probably talk to the management about it. There's enough stores in Nevada County that do have mask mandates, and that's where I go. I feel a whole lot more comfortable there. Even though fully immunized, I don't want to be exposed. And the mask mandates will all predicated by the numbers. So we follow the numbers very, very closely. And hopefully at some time in the future that we'll have numbers that speak that we won't need to be as cautious, but that's not now.
And with that, we are a minute over our allotted 30 minutes. So as usual, I'm going to ask you for your parting thoughts and what's next. Where do we go from here? And or do you have anything that to lighten the mood?
I think looking back at the last 18 months, like we had all sacrificed so much, closed down things and everything. And now we have a vaccine and we have masking and we have the ability to limit the spread of this virus. And it's up to all of us to kind of do that. So I do have hope. I have hope that we're going to all do the right thing, protect ourselves and our families and our community by getting vaccinated for both the flu and for COVID-19, and then wearing a mask out in the community.
So I have to echo what Dr. Stevens said. If you all remember how scared we all were at the beginning of this pandemic, we had a disease that was killing people. We didn't know how to treat it. We didn't know what it did. Over the course of these last months, we've learned so much. The medical community has learned how to treat the severe disease. We have medication that can prevent complications, and we have a vaccine. This is now a vaccine preventable disease. So I know I keep saying this, but getting vaccinated is the best thing you can do for your community and for yourself and your family to protect us all.
I'd like to piggyback on what Dr. Trochet just said, because we are still working at Public Health to vaccinate anybody who wants to get vaccinated. And if you are experiencing obstacles in doing so, hurdles in doing so, please don't hesitate to reach out to us. We will either get you where you need to be or come to you. So if you are interested in getting vaccinated, if you're on the fence about getting vaccinated, please don't hesitate to reach out to us. And I would like to add one other note, and I'm sorry it's a somber note, but it's Dr. Trochet just said it's a vaccine preventable disease, and some of the most serious illness and deaths that we're witnessing in this community, are in unvaccinated people. So there's a lot of suffering that is avoidable. And we're hoping that people take the steps that they can take to avoid that from either becoming ill or either leaving grieving loved ones behind or becoming a grieving loved one.
Thanks, Joe. Yeah, I like working with Joe. She's got a heart. But that's Public Health also has a heart. We're here for you. We're to protect the public, and we're here for you in any way possible, hopefully to immunize you. I read the other day a quote by Anne Frank where she said, "Nobody has ever become poor by giving." And if everybody just give a little bit, we'd be a much better world, much better society. And I think the health of the public would be a whole lot greater. So we're in it together. We're here for you. Thanks.
And with that, I would say that we'll reconvene in 2 weeks, and we're slowly getting better. And I think, Jill, what was it that you said? It was, what is it? Incremental, what was it?
Relentless incrementalism.
Relentless incrementalism. So
Yes.
baby steps, small steps, but eventually we'll get there, and it'll work out. So with that, everybody, please be safe. Also keep an eye on the weather for this weekend and beginning of next week. Just putting on my fire hat here for a second. And thank you again to all our panelists. Thanks to our participants. Thanks for your questions. And to everybody, thanks for caring for the community. Bye.